I thought the panel was amazing.
I think this was such a great experience tonight.
The panel was great.
I thought the panel was very insightful. I liked the mix of background and expertise. Tonight just really highlighted the tremendous opportunity we have in healthcare. I was really surprised to learn from the attendees how open they were in their questions. I found that to be absolutely courageous for people to just be so open and transparent about how they personally are using AI. My healthcare background experience professionally has been on the healthcare policy side. I too am using and learning AI as I go and really trying to understand the intersection of AI to business, healthcare, and policy work. Doing it in a safe manner. We don't have really good answers to this because it is still so nascent.
I am a student here at UCLA Anderson. I study business analytics. I think there is a lot of improvements that can be made in the efficiency, in the not in the clinical side because that's not my expertise, but in the administrative side, specifically with LLMs. In my opinion, the most difficult thing that innovators will have to go through is convince the management at these hospitals, at these companies, healthcare companies, to give out their patient information. What I learned tonight is that that's possible. I've learned that hospitals are open to actually implement these LLMs. I thought it was varied. There were people that were more clinical related, more business related, and I thought that it was well-rounded. I really liked that there was a lot of space for questions, and I thought the questions of the other guys in the room were very interesting people that came to attend. We all share something in common, and I think there is a lot to learn, not only from the panel, but also from each other.
I am in the healthcare and AI space. I'm interested in hearing from innovators, from clinicians, about the things we should look forward to, and also the challenges of bringing more AI into healthcare. I enjoyed hearing from the physicians, the researchers on the panel. I think it's interesting hearing about it both from a clinical lens and then also from kind of a research and science lens. And it was also really insightful to hear their resources and recommendations for how to get even more up to speed on what's going on in AI in healthcare. Most users, even the physicians and clinicians of the world, don't really know what's going on behind the scenes. How do we make that a bit more transparent and try to ward off some of those concerns? You're not just implementing something that's a black box, but you're understanding where the data is coming from as well as where your organization's data is going. The panel was great. Thought it was well represented of different viewpoints and roles in the AI space.
I came to learn about what providers are looking for from AI and machine learning overall. I learned that many providers are looking for co-pilots. They provided a lot of different perspectives, some that I didn't even consider. I think this was such a great experience tonight.
I thought the panel was amazing.
We had probably a lot more hours ahead if we could, spend the hours to talk about, healthcare and all things AI.
I suggest everyone to come into these types of events